Hello, it's Dr. Rhonda Johnson, and today is Friday, January 22nd, 2020. And today I'm going to be doing something a little bit different. I'm going to be three mini topics. The first is what's going on in Denmark with this super contagious strain and whether we should be doubling our mask. The second thing I'm going to talk about is the good news about the safety profile of the two COVID-19 vaccines. And lastly, I'm going to address this big old nasty rumor about infertility and the vaccines. But first, let's start with Denmark. Coronavirus cases there are up 70% every week in Denmark. And it's because of that new super-contagious strain out of the United Kingdom. Denmark's saying that this super-contagious strain now will dominate its cases by the middle of February. And the CDC acknowledges that this virus is already here in the United States, and it too is going to become dominant strain here by mid-March, mid to early March, which in Britain now, their prime minister is saying that this new super contagious variant may be associated with a higher degree of mortality. That means death, more people dying. Now, to me, this makes perfectly common sense, even if the data doesn't support it yet. But here's how it should go. More contagious virus means way more people are going to get infected, which means people with high-risk conditions are going to get infected, and they are more likely to die anyway. So, we're looking at another bad scenario here. So, again, people are starting to double their mask in preparation for the super contagious strain. Now, a lot of people wear cloth masks. And again, we've been wearing masks a long time. So if you're still wearing your original cloth mask, you may need to test them to make sure that they're still working for you. So sometime over the summer, I did a video where I blew out a candle with my mask on. So blow out a candle. Make sure you're not going to burn yourself or burn up the house, folks. Blow the candle out with your mask on. And if you can blow the candle out, your mask may not be protecting you. Okay, and so the other thing to keep in mind is you have to be able to breathe with the mask on. I recently tested myself out to see if I could breathe with a double mask on when I went to the grocery store. I wear a disposable mask, those light blue kind. That 3-ply mask is what works best for me. I tried a whole lot of different masks, but that's what works best for me. So I doubled up my masks, made sure that they were properly fitting. And I found that I had to walk a little bit slower when I was in the grocery store. So again, you have to be able to breathe while you have your mask on. So use your own judgment. But if you want to double up your mask, thinking that'll keep you safe, that's fine. Just make sure you can breathe, folks. I'm going to switch to vaccine safety. Good news today came out of the CDC Medical Journal, the weekly morbidity and mortality report. They looked at severe allergic reactions to both the Moderna and the Pfizer vaccine. Well, thank goodness the safety profile looks very good here. There were only 10 cases among the first 1 million doses of severe allergic reaction. That medical term is anaphylaxis to the Moderna vaccine. Reactions to the Pfizer vaccine in this early safety study showed there were 11 cases of anaphylaxis per 1 million doses administered. Now, this was the first dose in this data. So the vaccines appear very safe, but I still want to point out if you have a tendency to have life-threatening allergies, you should be talking to your doctor about maybe where's the best place for you to get this vaccine. Okay, now Walmart today said that it's going to be a COVID-19 vaccination site. And once the vaccine supply is available, they have committed to giving out 13 million doses a month, which will be good news because as of right now, it's very hard to get your hands on a COVID-19 vaccine. And in many communities, they have a Walmart. So I'm happy to hear that news. Lastly, this ugly rumor. Every day, every week, there's a new vaccine rumor. I almost need a notebook just to keep up with all these vaccine rumors. This time, it's about infertility. Folks, there is no scientific evidence whatsoever to suggest that the two COVID-19 vaccines can cause infertility, either in men or women. And the obstetric groups, the American College of Obstetricians Gynecology, and over in Britain, the Royal College of Obstetricians and Gynecology, they both have statements on their website that attest to this. Now, the basis of this rumor is that the vaccines, of course, code for the spike protein. And I don't know where this rumor came from, but they're saying that this protein is similar to a protein that makes up the placenta. And the fear is that the vaccine will ignite an immune response against the spike, the protein that's in the placenta. So, leading virology professors have stated that this Syncytin-1 protein, that's the protein from the placenta, is completely unrelated to the SARS spike protein, and therefore the risk of infertility is essentially fictitious. That means it's made up, it's just a rumor. Now, I went to some websites here. I went to the UPMC website, which has a website that addresses rumors, and the Allegheny Health Department website. And they both affirm that the vaccine does not contain this Syncytin-1 placenta protein, and there's no evidence that the Pfizer vaccine will result in sterilization of women. That means women who are infertile and can't conceive. So, folks, there's going to be a new rumor, a fear, misinformation that circulates widely about these vaccines every day, every week. Do a simple fact check. Type in your rumor on any search engine, and it should give you the facts that you need. I personally think it's great that people are questioning and are concerned, but I like to say these vaccines are a way we can be safe, and our families can be safe, and our communities be safe. They have been tested thoroughly in all these animal and clinical trials around the world. The science behind them is not new, and medical and health experts are analyzing every possible side effect. Pretty soon we'll have another vaccine on the market, the Johnson & Johnson vaccine. I talked about this yesterday. Yesterday, I thought the vaccine wouldn't come out until May or June. Today, they're saying it'll be here possibly March or April, which is good. Vaccination is the way out of this pandemic, folks. It really is, for us to get out alive. I hope you're thinking, planning, and when it's time to act, that you will make the decision that you think is best for you and best for your family and best for your community. Okay, that's my message today. My views are my own, as always. This is Dr. Rhonda Johnson, and stay safe, folks. Continue to practice your 3 W's and open up those windows briefly. We got to keep that air moving, even during the winter time, folks. We must get fresh ventilation, fresh air into the places that we live. Have a blessed day.